I'd like now to introduce today's speakers. First is Leslie Fierro. Leslie is a part-time epidemiologist contracted with the Air Pollution and Respiratory Health Branch at CDC, where she leads the development of evaluation indicators effort within the Community Interventions and Evaluation team. She's worked extensively in the areas of environmental epidemiology and public health surveillance. Leslie holds a Master's of Public Health degree in Epidemiology and Biostatistics and a Certificate of Advanced Study in Evaluation. She's currently pursuing a PhD in Evaluation and Applied Research Methods at Claremont Graduate University. Our second speaker today is Carlyn Orians. Carlyn is an evaluator with the Battelle Centers for Public Health Research and Evaluation in Seattle, Washington. She's worked with CDC and other agencies to design and conduct evaluations of many federal health programs. She's currently developing evaluation guidance materials to build evaluation capacity among state grantees that are part of the National Asthma Control Program. Carlyn is currently pursuing a Certificate of Advanced Study in Evaluation through Claremont Graduate University. Leslie, you want to start us off today?
Sure do. Great. Well, hello, and thank you so much for joining us today. I'm Leslie Fierro, and as Laney Wheeler noted, I'm joined by my colleague, Carlyn Orians, and we are just delighted to have been invited to present on a topic today that is so important to evaluation, engaging stakeholders. Can we go to the next slide, please? Here's a list of the topics that we will be covering during this webinar. Specifically, the definition of evaluation, what makes evaluation different from research, and CDC's evaluation framework. We will also discuss in detail what we are calling the who, why, when, and how of stakeholders. Additionally, we have drawn upon our work to identify examples that we think illustrate how stakeholders can be involved in each of the 6 steps of CDC's evaluation framework, as well as how engaging stakeholders helps to facilitate designing and conducting quality evaluations that follows the evaluation standards of utility, feasibility, propriety, and accuracy. Next slide. Okay, to set the stage for our presentation today, let's first revisit the definition of evaluation. Now, actually, there is no one definition of evaluation, and part of the reason for this is that evaluators differ in what they believe the ultimate purpose of evaluation is. Some examples include social betterment, use of evaluation information to inform program planning and decision-making by program managers, and empowerment of individuals so that they can conduct their own evaluations. And this becomes important when we think of engaging stakeholders in the process of evaluations because different evaluators will involve stakeholders to a greater or a lesser degree based upon what they believe is the ultimate purpose of evaluation. So here we've selected 3 definitions of evaluation out of the many that exist. The first is derived from a definition that I believe is from Dr. Michael Scriven, but quoted here from CDC's Framework for Program Evaluation and Public Health. In this definition, evaluation is the systematic investigation of the merit, worth, or significance of an object. The second definition is from Carol Weiss, and it states that evaluation is a systematic assessment of the operation and/or the outcomes of a program or policy compared to a set of explicit or implicit standards as a means of contributing to the improvement of the program or policy. And last but not least, we have a definition from Michael Patton, who's the thought leader in a type of evaluation known as utilization-focused evaluation. He defines evaluation as the systematic collection of information about the activities, characteristics, and outcomes of programs to make judgments about the program, improve program effectiveness, and/or inform decisions about future programming. So, looking across all of these different definitions, we can see one thing that they clearly have in common. All define evaluation as a systematic endeavor. So although we all tend to conduct evaluation activities informally every day, we go out to dinner and we decide whether or not we like our dinner and if it's quite right for us, here we see that evaluation is a systematic and more formalized endeavor. What I find particularly interesting about these definitions, however, is how they differ. The first definition emphasizes the role of evaluation in judging the quality of something. When this definition came into being, which was the 1950s, 1960s, evaluators were much more likely than they are today to have the task of evaluating a pilot or a demonstration project with the intention of determining whether it should be canceled, continued, or expanded. And that's what we now call summative evaluation. The last two definitions emphasize the importance of using evaluation findings. In these two definitions, we can see that there is an interest in assessing whether or not a program is being conducted as planned and whether the program is doing well. However, the purpose of evaluation here is to improve a program or policy, something we call formative evaluation. This emphasis on use for programmatic improvement is the definition that we adopt for our presentation today, and is also the one that's adopted by CDC in a self-study guide that accompanies the CDC Framework. This definition, the definition that's in this self-study guide, is that evaluation is the systematic collection of information about the activities, characteristics, and outcomes of programs to make judgments about the program, improve program effectiveness, and or inform decisions about future program development. Okay, change the slide, please. When I think about evaluation, what it is, what it isn't, and why it is conducted in the manner it is, I find it helpful to think through the differences and the similarities of research and evaluation. The important part here is that research and evaluation are not all about methods. Often, however, when we conduct research or evaluation, we are tempted to get to the bottom line. We have a question, and we attempt to find the most appropriate method for answering it. However, it's important to remember that both research and evaluation are enveloped in a broader context than just methodology. And it is that context in which these two types of investigations fit that is very important. The research and evaluation share the use of systematic methodology, and either can use quantitative, qualitative, or mixed methods to generate answers to pressing questions. Research and evaluation, however, differ in their purpose. So research is primarily conducted to add to an existing body of theoretical knowledge. Researchers often test theories in their field to uncover situations where the theory does not hold, so as to create a better theory, or they see something that strikes them as odd, so apples falling to the ground from a tree, for example, and set out to develop theories that explain these peculiar phenomena. So over time, researchers in a particular discipline, they test and they retest existing theories to build better ones. These theories are generalizable in nature. They are to apply across different settings, people, and time. The general purpose of evaluation, as we saw from the previous definitions, is to make a judgment of the merit or the worth of a program and to provide information for decision making. So we might ask questions such as, is the program doing what was intended? Is it producing the intended outcomes? Is it producing unintended outcomes, whether these are positive or negative? And we might also ask what steps might be taken to improve this program or to improve upon what has already been accomplished. Often the results of these evaluations are not generalizable, and I say often and not always on purpose, because depending on how the evaluation is designed, one can produce generalizable information. But more often than not, evaluations focus on highly specific situations. They are conducted for a single program to see if it's working in the context in which it resides. So the question then becomes, is this program working? Rather than, will this program work across multiple settings? Researchers and evaluators also differ in the number and types of roles that they play. Researchers typically only play one role, so they're experts in their particular content area. They identify gaps or inconsistencies in current knowledge. They derive questions to which the answers to those questions will help to fill the gaps that they've seen, and then they carry out their research. Evaluators, on the other hand, often play multiple roles, and this is largely because evaluation involves stakeholders in the process. So for example, the evaluator does not set out by themselves to identify and prioritize what questions will be answered in the evaluation. As you will see in some of the upcoming examples, evaluators work with stakeholders to generate a list of possible evaluation questions and to prioritize these questions, often based upon what is feasible and useful for the program. Thus, evaluators often play many roles, such as facilitator, educator, scientific expert, and even in some cases, counselor. Change slide, please. So to boil this all down, we can say that research seeks to prove, whereas evaluation seeks to improve. Next slide. And to improve a program, the findings from an evaluation must be regarded as useful. Engaging stakeholders increases the likelihood that the evaluation questions posed will be relevant to the program being evaluated, and that the information generated from the evaluation will be credible to key stakeholders. So Carlyn will now talk about the who, when, why, and how of engaging stakeholders so that we can get a better understanding of what is involved when we engage stakeholders in the evaluation process.
Hello, this is Carlyn Orians, and again, I want to thank you all for being here and giving us this opportunity to talk to you about how we can use stakeholders and why we might want to in the process of doing an evaluation. Next slide, please. I'd like to start by making sure that we have a common understanding of what we mean when we say stakeholder. One definition that we use is that stakeholders are people and or organizations that are interested in the program, are interested in the results of the evaluation, and or have a stake in what will be done with the results of the evaluation. So as you consider for each of your programs and your evaluation activities, who are the stakeholders, you want to ask that question. Who are the persons who are involved in the program operations? For example, this could be your asthma program staff or the partners that you work with to implement parts of the program. It can include persons served or affected by the program, so those who are involved in the asthma interventions, whether that's people with asthma, their families, caregivers, whoever is involved in those asthma interventions. And then the intended users of evaluation findings, which can include program staff and partners, but it might include another set of individuals as well. It could include advocates, funders, policymakers, and others. So for each program, that will differ a little bit. And what we encourage people to do is to develop a list at the start of any evaluation activity about who those stakeholders are for your program, because there is no one list that fits all. Each program is different. Next slide, please. For many programs, the list of stakeholders is potentially very long, and it might seem rather a daunting task to figure out how you might engage all of these stakeholders. It's important to consider who they all are and their perspectives and interests, but what you need to do when you review the list is to think strategically about which stakeholders are the most important for the activity you're undertaking. These 4 questions that are listed here are questions that can help you think about which stakeholders are the most important for your evaluation. Specifically, who do you need to enhance credibility? Who do you need to help implement program changes that you want to make based on the evaluation results? Who might be in a position to advocate for those changes? Who funds or authorizes the program? Who might be important if your goal is to expand the program to different areas, different populations, or to make it permanent? So these are questions you need to ask about your longer list of stakeholders to consider who is the most important to involve. Next slide, please. So why would you want to engage stakeholders? What might be the benefits? Well, first of all, it is an important part of the CDC evaluation framework. So it's an important part of the framework, which has, as Leslie described, has a focus on use. And it's also maybe, depending on the program that you're with, be an expectation about the way you conduct evaluations. And of course, stakeholders can add credibility. If you want the results to carry weight and be acted on, you want to make sure that they will be viewed as credible, and stakeholders can help you with that. It may also be the case that stakeholders have important resources that you can use, whether that's data, skills, analytic skills. So think in terms of the resources your stakeholders may bring to your efforts. They also may be critical to implementing or advocating for action based on the results. And finally, you may be able to build trust and understanding among program constituents through involving them in the evaluation. I think many people have a great deal of fear about evaluation, and the fear tends to be greater to the extent that people don't know what it is. And I've often found that when you engage them in the process, even if it's just to keep them informed about it, what it's going to cover, how it's going to be used, it makes people more comfortable. It helps build understanding and build trust. Next slide, please. You may wonder, why would stakeholders want to be involved? And indeed, not all stakeholders do want to be involved, and that's an important first step is figuring out who is interested and what their interests might be. But some of the reasons stakeholders might be interested in participating in evaluation is that they have questions they'd like answers to. They may also be interested in learning about evaluation and building capacity for themselves or others in their organization. They may also have strong feelings about the kinds of methods that would be appropriate or the design of the evaluation, and they might want their voices heard on that. They may also feel protective. This goes back to the question of fear and trust. If they're protective and they're worried that evaluation could bring harm to them, they may enter it into the evaluation effort simply to protect their interest and protect their constituents. And it's important that you understand that. And many people are motivated to participate because they believe in the program, they want it to be successful, and they believe that helping with the evaluation will give them a role in seeing the success of the program. Next slide. So here's the CDC Evaluation Framework, which is probably familiar to most of you. There are 6 steps in this framework. The first of those steps is engage stakeholders. The steps that follow from there are describe the program, focus the evaluation design, gather credible evidence, justify conclusions, ensure use, and share lessons learned. So although the first step is engage stakeholders, it doesn't mean that it's something you do only at the beginning and then let go. And as we walk through the examples today, you'll see how that first step feeds into the entire evaluation framework. Next, please. You can use the CDC Evaluation Framework to engage stakeholders in identifying and prioritizing evaluation questions, in selecting credible sources, and in developing a plan for action based on those evaluation results. It's true, you actually can use stakeholders in all of those ways. But, and this is an important caveat, it doesn't mean that you have to engage them in all those ways in every evaluation. It depends on several factors. Next slide, please. How you engage stakeholders depends on evaluator preference, but it also depends on stakeholder preference. So is this a way in which you like to operate and a way in which stakeholders would like to be engaged? It also may depend on resources, and that you can think about in 2 different ways. Do you have the luxury of time for engaging them? Do you have the means to meet with them and get their opinions? But you also may need their resources. As we talked about before, the stakeholders may bring important resources to the table. So it may be important to engage them if there are resources they have that you need. And it may also depend on the degree of trust or the threats to credibility that you believe exist in a given situation. If there is a high degree of mistrust, it may be especially important to engage stakeholders up front in considering how you will proceed with the evaluation, giving people opportunities for input, opportunities to critique, so that at the end of the day, you have evaluation results that people will find credible and that they will be willing to act on. Next slide, please. What I'd like to do is just very briefly walk through what the 6 steps are in the framework and how you might think about stakeholder involvement in each of those steps. And then we'll move into some concrete examples so you can see what this means. Step 1, engage stakeholders. We've already talked about who should be involved. Develop your list of potential stakeholders. Use those 4 questions to help you decide who are the most important to include. Step 2 is describe the program. Do stakeholders share a vision of what the program does and its intended outcomes? Do they have diverse views? Or do they have similar views? It's important to know this as you embark on a program evaluation, and you may want to make sure that you engage them early on so that you understand what vision stakeholders have in their heads for your program. Step 3 is focus the evaluation design. What are the most pressing and important evaluation questions for stakeholders? Leslie talked about this a little earlier. In research, often an investigator comes and they have their set of questions. With evaluation, it's much more common that it's the stakeholders who are the source of the evaluation questions. What do they need answers to? If they're going to take actions on the results of the evaluations, what questions do they need answers to be able to take action? That's a very critical role for stakeholders. And what methods can they contribute to? Which ones do they prefer? Or what will be considered credible evidence for them? Next slide. So step 4 is gather credible evidence. We just talked about that, the importance of knowing what your stakeholders will find as credible. Justify conclusions. So how do diverse stakeholders interpret the findings? You may want to engage them in doing the analysis, or you may prefer to bring results to them before they are finalized to get their interpretation. Have they thought of a different take on the findings than that which you may have had? And then the final one is ensure use and share lessons learned. And as we've talked about already, when you take an approach to evaluation that's focused on program improvement and on using those results to take action, this is really a critical step in which stakeholders can play a role. What I'd like to do is walk through an example. So here I'm posing for you an intervention in the home environment in low-income apartments. This intervention is to improve indoor environment for children with asthma through several activities, provide education and training for apartment owners, building inspectors, maintenance vendors, and tenants regarding asthma triggers and housing codes, work with city officials to enhance existing housing code, promote smoke-free housing. So now we're going to walk through the 6 steps, how you might engage stakeholders in an evaluation of an intervention that looks like this. Next slide. So who should you include? Who are your stakeholders in this evaluation? Possibilities include affected families, which are those who are living in the housing that you're trying to improve. Also those who receive training, the owners, the inspectors, the maintenance personnel, and the tenants themselves, as well as your trainers. I know sometimes in programs, the program staff do the training themselves. Sometimes you get an outside group or partner to be involved in that training. So they're certainly one of your stakeholders, the ones that are actually providing the training. And then since you're trying to make changes in the indoor environment, city officials who have responsibilities for the housing code may be important stakeholders for you to consider involving. There also may be important advocacy groups out there who are, for example, advocating for smoke-free environments. And this is not a complete list. You will need to think about the setting in which you're operating your program, your intervention, to see if there are other important stakeholders, whether those are groups that are likely to be resistant or groups that are likely to be advocates for the kinds of changes that you're trying to make with your program. And it's important to include a mix of views because you don't want to be surprised at the end and have failed to consider something that is important to one of these audiences. Next slide. So what are some options for including stakeholders in step 2? And step 2, again, is describing the program. Well, it might be very important to get their views on the current indoor environment and the changes that they would like to see and that they think are realistic to achieve. I think stakeholders can be very important in assessing the realism of the changes that you're trying to make. But it's also important to understand what changes they want to make. What outcomes do they think are important? Because these will be important for your evaluation design. And I mentioned this already, but a logic model is one way that you can look at how activities contribute to outcomes and engage your stakeholders in that discussion. And that will be covered in more detail in the next webinar series. Slide. Step 3 is focusing the evaluation design. How might you engage the stakeholders in this step, in this particular example? You might want to know what questions they think are the most important. Should the evaluation, for example, focus more on changes to the housing code, or are trigger reductions most important, and which triggers? And what is the best design? Should the evaluation look at the conditions before and after? Should they look at the changes that are made to a group of houses compared to an apartment building in which the program has not worked to see if there really is a difference between the group you're working with and a control group? Or are observational methods more appropriate? And your stakeholders can be really important sources of information for that focusing of your evaluation design. Next slide, please. So step 4 is gathering credible evidence. How might stakeholders be engaged in that in this particular example? Well, you might consider whether there are stakeholders that can provide access to the residents or provide translation services. You may find that they can play a very important role in giving the kind of access and entry into the population that you need to successfully conduct this evaluation. The trainers may also be very important. Can they help collect data before, during, or after each training? Are there other opportunities for data collection as the evaluation moves forward? Can your stakeholders play a role in that? And then it's also important to think about your stakeholders' needs for information. Will they be more influenced to act based on information on environmental conditions? Will they care more about what effect it's had on the use of medical care or on asthma symptoms? How will they react to different kinds of information? Will they be more moved by pictures, by stories? Do they need numbers? Do they need cost data? What is the type of information that they will need to take the action that you're hoping to see from your evaluation? Next slide, please. Step 5 is justify conclusions. I think it's very important to know and get input from the stakeholders on how they view success. I think very often we carry in our own heads an idea of what success looks like. And if we don't explicitly share that and talk about that, we may be surprised that other people view that differently. They may be very happy with an outcome that surprises you, or not be happy with one that you think is important, and it's very important to get that kind of input. It's also important to know if they have different types of interpretation of the data. If you present them with one explanation for the changes that you're seeing, will they agree with that? Do they have a different explanation about what's going on? Or do they perceive barriers to making changes that you might not even have considered? So stakeholders can give you really important information on interpreting what you have found. Next slide. Step 6 is ensure use and share lessons learned. And here again, think about the stakeholders that you have. Are they in a position to help you disseminate information? Perhaps there's an owner's newsletter, or a tenant meeting, or a neighborhood association. These can be important ways that you can share information with the stakeholders in your program. It's also important to consider whether these different stakeholders have different needs for information. Is a report the best way to reach some? Do some need an executive brief? Do some need an oral presentation? What is the best way to share that information? And another thing to consider, let's say you're doing a program in a particular place, but maybe there would be interest beyond that location or beyond that particular audience. So when coming up with your plan for sharing lessons learned and making sure that the results are used, think a little bit more broadly, and your stakeholders can help you think about that. Who else? Who else might be interested in the information? What are other audiences you might want to consider? Next slide, please. So in this particular example, which is trying to make changes in home environment in low-income apartments, what would happen if you ignored stakeholders? Are there potential problems or pitfalls you would encounter if you ignored stakeholders in doing this evaluation? Well, here are some potential pitfalls that you might encounter. First of all, you might fail to ask important questions. For example, maybe it's important to know if tenants have access to quit smoking services, if you're hoping that they will not smoke in their apartments anymore. It also may be difficult to gain access to or the trust of people in the program. Can you get into their homes? Will they receive you? Are there data that you need from the housing office, from an owner's group? And do you need to have their involvement to get the information that you need to do your evaluation? You also might fail to uncover unanticipated consequences. For example, maybe you'll discover through talking with stakeholders that they're concerned that if improvements are made, rents might increase. This may be something that you need to include in your evaluation and take a look at. There might be other surprises. So that engagement can give you information about things that are not something that you had as the focus of your evaluation, but that might be ultimately very important to know. You also might fail to communicate the results in ways that are understood or accessible to the audiences that you have in mind. Are there literacy issues in the audiences you need to reach, or language barriers, or are there cultural preferences for how they like to receive information? If you take the time up front to learn about that, you're much more likely to get information that is usable and well received into the hands of the people who need it. So real take-home message is your evaluation might not lead to action, at least the action that you want, if you don't at least consider about the ways you might engage your stakeholders. Next slide, please. An important point in all of this is that the way in which you engage, who your stakeholders are and the way you engage them is going to vary from project to project, from evaluation to evaluation. So how might you look at these questions a little bit differently in a different example? I'm not going to walk through all the steps in this next example, but I just want to give you a flavor for how you might think about it a little bit differently. In the second example, we're looking at care coordination across health systems. This is an intervention to provide and integrate care coordination and case management for high-risk children with asthma. The intervention involves standardizing protocols across care systems, including Medicaid HMOs, home nursing agencies, and health departments. The goal is to prove success and thus convince insurers to continue reimbursing case management services. So how might stakeholder engagement be different in this example? First of all, we would have a different set of stakeholders. These stakeholders might include insurers, case managers, families, health system administrators. They might also be interested in a very different set of outcome questions. For example, they might be really interested in whether this is an intervention that they can sustain. If they did a pilot to see what the cost of doing this kind of case management, what kinds of outcomes do they need to show to answer the question of whether they could sustain this? They might prefer particular kinds of data to help give them that proof, to help give them that information to make those decisions. Some of these stakeholders may value quantitative data more highly than other types of data. And they might need to see evidence of cost savings to be willing to act. And you might find that some of these stakeholders have very different interest in or ability to participate in evaluation. They may be very busy, they may have a lot of time constraints, and you may need to be very sensitive to the ways in which they'd like to be involved and can be involved so that you facilitate that interaction in a way that they're going to be comfortable with, that you're going to be comfortable with, and make things work. And of course, every program, every evaluation has its own political environment, and you need to think through what that is so that you're hearing the right voices and presenting information that will lead to the action in the political context that you want to see. Now I'll introduce a third example, which is daycare education. In this third example, this is an intervention to train child care providers to identify triggers and to manage children with asthma. This intervention reaches out to large daycare centers and licensed home daycare programs. Participation in the program is encouraged through continuing education credits. The long-term goal is to expand this beyond a pilot to the larger community. How might stakeholder engagement be different in this example? Once again, we have a different set of stakeholders. These stakeholders might include trainers, daycare providers, licensing boards, and families. And the outcomes are likely to be quite different than the examples we looked at before. Here we might be very concerned with behavior change, with environmental outcomes, and with the kind of evidence that would be used to support a decision to expand beyond the pilot centers. The design mix, the evaluation design might be different. We might consider a pre-post control design, and we might think about different data collection methods. It may be that particular success stories are important with this audience to convey the evaluation results. And again, the audience for your evaluation results will be different in this example.
Okay, so we've heard from Carlyn about the ways that stakeholders can be engaged in each of the steps in the CDC framework that you see around the outside of the circle. So what I'm going to do now is provide you with a brief example from some of our recent work in the Air Pollution and Respiratory Health branch at the CDC to demonstrate how engaging stakeholders helps in carrying out the 4 evaluation standards that reside at the center of the CDC framework. Next slide. These 4 standards, utility, feasibility, propriety, and accuracy, were developed in the 1970s by the Joint Committee on Standards for Educational Evaluation. Now, although these were developed for educational evaluation, they are really every bit as applicable to other disciplines that conduct evaluations, so that includes public health. And it probably appears from this presentation and the circular figure that you just saw depicting the CDC evaluation framework that there are only 4 standards. But in fact, there are a total of 30 standards that sit under these 4 headings. A more detailed list is available in CDC's framework. Well, as you all know, often in public health and in evaluation, we're dealing with a limited budget. And this means that we can't always develop an evaluation design in a way that we feel is ideal. So, you know, in many cases, it seems almost inevitable that there's going to be trade-offs that are going to occur. And what the standards do is they provide evaluators with guideposts that can help them and their stakeholders make difficult decisions when they're designing and implementing an evaluation. Additionally, they're a good way to judge the quality of an evaluation and to see where an evaluation can be better balanced. Well, when we consider the utility standard, we think through who needs the information from the evaluation as well as the types of information these individuals need. And Carlyn spoke about that, and I spoke about that a little bit earlier too. The standards residing under this heading include items such as identifying stakeholders who are involved in or affected by the evaluation. And other standards under this heading include collecting data that addresses important questions about the program being evaluated and making sure that this data is responsive to the needs of stakeholders. The standards associated with feasibility help evaluators to ensure that the evaluation will be viable and pragmatic. Using the standards under this heading, we aim to keep the burden associated with data collection as low as possible. We acknowledge that political interests of individuals who are involved in or interested in the evaluation findings, and we make every effort to assure the evaluation is cost-effective. The propriety standards lay out items that are very important to consider with respect to ethics. This includes ethical treatment of the individuals from whom data will be collected, as well as the individuals who may have commissioned the evaluation or could be affected by the findings of the evaluation. And for accuracy, a set of standards exists that help the evaluator to design and implement the evaluation so that the results will be technically adequate to inform decision-making. Now, there are 12 standards under this heading, and some include being sure that the program that is being evaluated is documented clearly and accurately. And so we talked about that earlier when we were talking about the importance of logic modeling. Some other standards, for example, include gathering data in a way that will produce valid and reliable information, as well as analyzing and reporting the data in a systematic and unbiased way, and then also assuring that the source of the information is defensible. So in other words, how adequate is the data for answering the evaluation questions at hand? So let's see these standards in action. Can we change the slide, please? So in 2006, the Air Pollution and Respiratory Health Branch initiated a collaborative process to develop a program monitoring system for the Asthma Control Program. This program currently funds 35 states and territories to implement statewide asthma control programs using a public health perspective. This approach involves engaging, enhancing, and maintaining relationships with partners across the state or territory, developing, improving, and conducting asthma surveillance activities, and designing and implementing interventions with partners across the state. So as Carlyn mentioned, this example is a little bit different than the types that she provided. Here we're looking at an example that includes collecting information for the purpose of evaluation across multiple sites rather than designing an evaluation that's specific to one site. Change the slide, please. The purpose of this endeavor was to develop a strategic, systematic approach to collecting information about our program activities, our progress, and accomplishments across all of the funded states. And to accomplish this purpose, we engaged stakeholders, and these stakeholders included the staff within the CDC's Air Pollution and Respiratory Health Branch and representatives from funded state asthma programs. To develop the content of this monitoring system, we engaged with stakeholders in a process that was driven by the steps outlined in the CDC Framework that Carlyn has given us some examples of. We developed a series of logic models describing the program. We identified and prioritized key evaluation questions that we wanted to be able to answer at a national program level. And then we embarked upon creating a data collection instrument that would help us in gathering data on a regular basis across all of the funded programs. So I'm going to focus here on the creation of this data collection instrument and how our collaborative approach was aided by the evaluation standards. We used an iterative approach in designing this data collection instrument. First, a workgroup consisting of staff from the Air Pollution and Respiratory Health Branch worked together to identify core information needs and to create a draft of the core data collection instrument, which is essentially a survey instrument. This draft instrument was then shared with a work group of state representatives who reviewed the instrument, pilot tested it, and provided extensive comments about how it could be improved. A subset of states represented on the work group filled out the instrument and provided me with some data so that I could create a mock report, something that would demonstrate the type of information that might be generated through such a program monitoring system. The mock reports and state comments were then brought back to the CDC work group to discuss the comments and modify the data collection instrument accordingly. So you might be asking yourself, well, how were the standards employed in this example, and specifically, how was engaging stakeholders important to fulfilling each of these evaluation standards? Can we change the slide, please? So here are some questions that we might pose when we're thinking about the standard of utility to ensure that the information needs of intended users are met. In this case, the primary intended users of the information coming from the monitoring system were the staff at the Air Pollution and Respiratory Health Branch. It was anticipated that project officers, evaluators, epidemiologists, and managers would use the information from this system to examine the progress that was being made across all of the states in aggregate form, identify patterns that occurred in practice that were promising with the intention of sharing these practices across the states, and also identify areas for improvement both within the states and at the national office. The states were considered to be secondary intended users of this information. They might, for example, query the monitoring system to see how states similar to them were doing in particular areas, or to see how similar states were designing and carrying out their own programs. Change slide. To carry out the utility standard, we wanted to know what type of information CDC needed to do their job and ways that they might use the information. We also engaged states in similar discussions, inquiring as to whether they felt the information we were collecting might be useful to them and how we could make the information more useful to them. And as I mentioned earlier, mock reports were developed to facilitate conversations with individuals at CDC about how the data might be used, because sometimes it's just easier to know how you would use information if you see it right in front of you. Change slide. The feasibility standard was also very important to this work. States are asked for a variety of information already, as many of you know, through semi-annual reports, end-of-year reports, and so we wanted to be very cautious of how much more we asked and in what instances we could streamline data collection processes. Additionally, it was recognized that time used to provide answers to the questions that were posed in this data collection instrument was time that would be taken away from other programmatic activities. Change slide. Throughout our process, we attempted to be mindful of asking questions that would provide CDC with need-to-know information, not just things that would be nice to know. Furthermore, during the pilot tests with states, we asked specific questions about feasibility. For example, we wanted to know if the information we were requesting was already collected by the program, or if it was easy to obtain or estimate it. Furthermore, it was important for us to consider how long it would take to obtain the information and fill out the instrument. As was outlined in the feasibility standard, we wanted to keep the burden that was associated with this data collection as low as possible. Ultimately, deciding on the content of this instrument was a careful balance between feasibility and utility. If a piece of information was high up on the list of the need-to-know items, then we might unfortunately need states to take on some additional data collection and reporting burden, while, of course, finding other questions that we could eliminate to help balance out the burden. Change slide. Program monitoring systems are tricky in the sense that the data collected through these systems ultimately can be used to generate performance measures or program indicators. So these are not just numbers. They imply meaning, and in particular, they carry with them the connotation of whether or not a state or a national program is doing good or they're doing bad. Thus, the information produced using the data collected through the instrument could have implications. As we discussed earlier, this consideration lays squarely under the standard of propriety. We needed to be very understanding that the information could affect programs associated with this monitoring system at both the state and the national level. Change slide. As already described, we truly embarked on and carried out a highly collaborative process in which states and CDC staff were highly engaged. We attempted to create an atmosphere where individuals participating would feel free to share their expectations and their concerns. And most importantly, we tried to be highly responsive to any of the concerns that were expressed by the stakeholders and change the instrument content when it was needed. Change the slide. In the previous slide on propriety, I talked about how the data collected could have implications for state and national programs. Therefore, it was also important to give detailed consideration to how accurate the information collected through the instrument would be. We really needed to feel comfortable that the information produced would be valid and reliable, and if we discovered that a particular piece of information may not be provided consistently over time and or provide us with information that we felt would adequately represent the concept of interest, we really needed to consider whether it was worth collecting the information at all. Here you can see the balance that occurs between the standards. So even if the information is feasible to obtain, it may not be accurate, and limited accuracy could have serious implications for programs, thus drawing out the importance of that propriety standard. Change the slide, please. So to help us examine the accuracy of the data collected, we asked states who pilot tested the instrument a number of questions, some of which you see on this slide. And we wanted to know where individuals were guessing. And we had discussions about where we felt a best guess was acceptable and where it absolutely was not. We also asked about the quality of information and ways that we could revise the instrument to collect information that would help us to improve the accuracy of the data provided. Of course, it isn't always the case that an instrument can be adjusted in a manner that improves the accuracy of information, so we also had to consider just throwing some questions out. Change the slide. Okay, so that's the end of that example for the monitoring system. And so here's just kind of a brief recap of what we have reviewed today. So we've talked about the goal of evaluation and the role of stakeholders, who to engage, why it's important to engage stakeholders, when and how to engage them, how stakeholders can be involved across all of the steps in the CDC framework, and as well how they can be involved in fulfilling the standards. And then it provided some examples for both single and multiple sites. Next slide. So thank you so much for joining us. We really hope that the information that we've provided will be helpful to you in your future evaluation endeavors, and then we thought we would provide you with our contact information in case you have any additional questions that we maybe don't have time to answer now.